In part one of this video, I explained what to expect during pregnancy ultrasound scan according to the various trimesters. In this video, I'm going to be explaining the various pregnancy complications we have according to the various trimesters that are visible on ultrasound scan. Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound. During the first trimester scan, the two big questions we answer are the location of the baby and the viability, which brings me to the first complication, that is ectopic pregnancy. Ectopic pregnancy is a situation where we have the baby growing outside the womb, usually in the fallopian tubes. This is a life-threatening situation because the womb is the only organ that has the ability to expand to accommodate a baby for 9 months. No other location or region of the body has this ability, and it requires medical intervention because that part of the body cannot accommodate the baby for 9 whole months. Usually, the patient will experience pain in the pelvic region, the patient will experience spotting or bleeding. There will be a positive pregnancy test, but the uterus will be empty. That's an indication to look out for ectopic pregnancy. Another complication that is visible in first trimester is the anembryonic gestation or blighted ovum. After conception, the first thing that is formed is what we call the gestational sac. The gestational sac is actually what houses the baby. It's like the house of the baby. Following the gestational sac is the yolk sac and then the fetal pole. But in anembryonic gestation or blighted ovum, we usually have an empty gestational sac. That is, the gestational sac is formed, but no baby is formed inside that sac. The sac is usually empty. The patient might not have any symptom. They only discover when they come for their first ultrasound scan. And in some cases, the patient might have bleeding or spotting, which makes them to come for the scan, and they discover that the sac is usually empty. In such situations, there is no medical intervention required. The pregnancy will have to be terminated because the pregnancy cannot proceed. Because the pregnancy is not viable, there is no baby, and so the pregnancy will have to be terminated. The third condition is subchorionic hematoma or hemorrhage. This is a situation where we have bleeding between the uterus, the walls of the uterus, and the gestational sac that houses the baby. It could be mild, it could be moderate, it could be severe. If it's mild to moderate, it can go off on its own after a while, but if it is severe, it will require medical intervention. The fourth complication is missed miscarriage. In missed miscarriage, the gestational sac is formed, the yolk sac is formed, even the baby is formed, but along the line, the heartbeat of the baby is no longer there. That is, the baby dies inside the womb. It is called missed miscarriage or silent miscarriage because the patient might not experience any symptom, but the baby is no longer progressing or the pregnancy is no longer progressing. And in some cases, they might also experience spotting or bleeding that makes them to come for the scan. And then we discover that there is no cardiac activity, there is no heartbeat. And in such cases, there is no way to revive the baby. The pregnancy will also have to be terminated. In second trimester, we begin to look at structural formations, we begin to look at the placenta, if the placenta is low-lying, if it's previa. In low-lying placenta, it's a situation where we have the placenta close to the cervix. But as the pregnancy progresses, as the womb expands, there's a possibility that the placenta may shift away from the cervix. We also look at placenta previa. There are different kinds of previa. We have marginal previa, we have partial previa, and we have complete previa. In marginal placenta previa, the placenta is close to the cervix, but not touching the cervix. In partial placenta previa, it's a situation where the placenta is partially covering the cervix, and in complete previa, it's a situation where the placenta is completely covering the cervix. In complete placenta previa, the mother will have to undergo a cesarean section. Usually, the mother might also experience slight or painless bleeding. We also look at the structural formation of the baby. It is in second trimester that the anomaly scan is done, where we look at the organs of the baby. We could see complications like hydrocephalus, which is a situation where we have fluid collection in the brain of the baby. We could also notice complications like spinal bifida, where the spine is not completely closed. We could also see abdominal wall defect. I've had a patient that had a baby with an abdominal wall defect. The organs of the abdominal region were outside the abdomen. But she decided to keep the baby and go for a surgery after the baby is born. We could also see limb deformities, where we have short limbs or incomplete limbs. We could also see heart defects, where we have holes in the heart or incomplete chambers of the heart. These are the complications we could see during the course of the anomaly scan. In second trimester, we also look out for the amniotic fluid volume. If it is plenty or if it is small, we call it polyhydramnios. This is a situation where we have excess amniotic fluid. If it is low or less, it is called oligohydramnios. This is a situation where we have little or no amniotic fluid. And this amniotic fluid volume is an indication of the fetal well-being because the fetus actually regulates this volume. It swallows this amniotic fluid and excretes it in form of urine. So when we are having too much amniotic fluid, it's an indication that the baby is having difficulty with swallowing. And when we have less amniotic fluid, it's an indication that the fetus is having problem with excretion because it passes out this amniotic fluid and also takes it in. The baby regulates this amniotic fluid volume. So the volume of the amniotic fluid is an indication of the well-being of the baby. In the third trimester, we look out for the growth of the baby. We look out for intrauterine growth restriction, where the baby is smaller than the supposed gestational age. We also look out for the line position of the baby. At this stage, we are checking if the baby's head is down. The baby's head is supposed to be down at this point. We are also looking out for the fetal weight. We could have fetal macrosomia, where we have an abnormally big baby, bigger than it's supposed to be while still in the womb. And we also look out for placenta insufficiency. Placenta insufficiency is a situation where the placenta is not giving the baby enough oxygen as it should, because the placenta is the connection between the mother and the baby. So in summary, in first trimester, we are looking out for the baby's location and viability. When I say viability, I'm simply referring to the presence of cardiac activity or heartbeats. In second trimester, we are looking out for structural development, how well the baby is forming, if there are any congenital abnormalities, and the placenta location and the fluid volume. In third trimester, we are looking out for the baby's growth, the weight, and the delivery planning. That's the lie of the baby. Pregnancy ultrasound scan is not just a tool to see the baby. It is a tool that ensures the safety of both the mother and the baby and ensures safe delivery. It helps to detect abnormalities early if there are any and ensure adequate medical intervention. If you have any more questions or confusions or experience you would like to share, feel free to drop it in the comment section. If you found this video helpful, don't forget to like, share, and subscribe. And I'll see you in my next video.